Hello, I'm Marites Vitug and welcome to Rappler Talk. We are going to speak today to Ambassador Michael Peiyung, who is the representative of the Taipei Economic and Cultural Office in Manila, or TECO. We have read a lot about Taiwan being a model in handling the coronavirus crisis, so we're privileged to speak to Ambassador Peiyung to tell us about how Taiwan was able to combat or fight the coronavirus. Ambassador, can you please tell your story? What were the major steps taken by Taiwan in fighting the coronavirus?
Okay, thank you very much. I would like to share with you the important timelines and the measures we implemented to contain the spread of the COVID-19 pandemic as follows. On December 31st, 2019, after we learned a typical pneumonia cases in Wuhan, China, we immediately informed the WHO and the China CDC via emails. At the same time, our officials boarded planes and inspected passengers for fever or pneumonia symptoms on direct flights from Wuhan. On January 2nd, 2020, we strengthened the suspected case reporting and the hospital infection control of healthcare system. On January 5, 2020, advisory committee on atypical pneumonia in China was formed by Taiwan CDC. On January 7, 2020, travel notice level 1 advisory for Wuhan was announced by Taiwan CDC. On January 15, 2020, Class 5 infectious disease was announced by Taiwan CDC. Category 5 communicable disease means emerging communicable disease or syndromes mentioned by the central competent authority to cause a substantial impact on the health of the population through their transmission and to require formulation of preventive and control measures or preparedness plans in accordance with the Communicable Disease Control Act in Taiwan. On January 20, 2020, travel notice level 2 alert for Wuhan was announced by Taiwan CDC. On the same day, the Central Epidemic Command Center, CECC, was activated by Taiwan CDC. On January 21st, 2020, travel notice level 3 warning for Wuhan was announced by Taiwan CDC. On January 22nd, 2020, emergency meeting of Taiwan National Security Council was summoned by President Tsai Ing-wen to integrate and coordinate inter-ministry efforts on the containment of COVID-19 outbreak, financial relief, and economic stimulus. On January 30, 2020, public health emergencies of international concern was announced by the World Health Organization. On February 6, 2020, we banned Chinese nationals from entering Taiwan. Foreign flag crews were also banned from docking in Taiwan. Starting from February 7, 2020, all foreign nationals who in the previous 14 days had visited or resided in China, including Hong Kong and Macau, were prohibited from entering Taiwan. And starting from February 10, 2020, direct flights to and from China were suspended. Starting from March 19, 2020, foreign nationals were prohibited from entry without special permission. All inbound travelers are subjected to home quarantine for 14 days. On March 21st, 2020, travel notice level 3 warning was announced for all countries in the world. Starting from March 24, 2020, airline passenger transits through Taiwan were also suspended. The above mentioned are all the measures taken by my government to contain the spread of the COVID-19 pandemic.
So, your government acted very early as December 30?
Yes, my government acted, very early. When we learned, yes, the first case, happened in Wuhan, last December 31st. Yeah, we have already taken the measures needed. Yeah.
So far, Taiwan has reported 429 cases and
Yes.
six deaths. And yet,
Yes.
you're very close to China. So geographically, so how did you take extra measures to be able to contain the pandemic because you're so close to China?
Yes. Thank you. Actually, we are not only geographically close to China, the people-to-people exchanges are also very frequent. Over 1 million Taiwanese people are now living, working, or studying in China. In addition, over 4.33 million tourists from China, Hong Kong, and Macau visited Taiwan in 2019. Therefore, Taiwan was naturally expected by international community to be the worst hit country of COVID-19. Taiwan learned a hard lesson from the SARS outbreak in 2003 that we can only rely on ourselves. In short, hard lessons of SARS pandemic have prompted us to be much more vigilant on the outbreak of the emerging infectious disease from China. When a Taiwan CDC official unintentionally found out that there were 7 atypical pneumonia cases in Wuhan, China on December 31st, 2019 from the internet, we highly sensed it to be a serious one and have started taking ongoing precautionary measures ever since. Taiwan CECC, the Central Epidemic Command Center, has regularly produced and implemented a list of at least 124 items in 5-week period, including border control from the air and the sea, using new data and technology to identify cases, quarantine of suspicious cases, proactive case finding, resource allocation, reassurance and education of the public, etc. Together with the medical professionals, private sectors, and the society at large, Taiwan is able to contain the spread of the COVID-19. Up to date, we only have, like you mentioned, 429 confirmed cases, and there is no community outbreak.
Um, how I was wondering, how come Taiwan did not use a lockdown? How come you did not resort to a lockdown like many other countries have done? What's so different about Taiwan?
Thank you for asking this question. I remember one frontline health worker in Taiwan told me that we have prepared this pandemic for 17 years. When SARS devastatingly hit Taiwan in 2003, after the bitter experience learned from SARS outbreak, we have adopted the following measures in public health disease prevention. First, continue to monitor emerging infectious disease in the world, especially populated countries in the region, such as China. Optimize border quarantine, strengthen infectious disease reporting and healthcare system. Put responses plans of emerging infectious disease into drills. Update laboratory for early detection and diagnosis. Promote comprehensive public health education for school children and the general public. Implement open and transparent information sharing. Enhance international collaboration in pandemic containment, research, and development. On January 21st, 2020, Taiwan had the first confirmed case of COVID-19 from Wuhan, China. As of April 26, 2020, Taiwan only reported 429 confirmed cases. Nearly 80% were imported cases. Taiwan's strategies for combating COVID-19 include optimization of border quarantine, travel, occupation, contact, and cluster history, and health checkup. Enforcement of a 14-day home isolation quarantine, including contacts of confirmed cases, passengers, from epidemic areas, mobilization of healthcare system for infectious disease, 20,000 isolation rooms with 14,000 ventilators are ready, enforcement of social distancing, keeping a queue distance, avoiding large-scale gathering, economic relief, stimulus, financial support for families and business in need, research and development of rapid diagnostics, antivirus, and vaccines, international collaboration including PPEs, pharmaceuticals, technologies. Now we have joint research with the US and the European countries. However, we are still highly aware of the threat of this pandemic and will be prepared for any possible upcoming situation and development.
Ambassador, I noticed that you did not include mass testing in one of your measures. You did not find the need to do mass testing.
Yes, you know why? Because first, it's too costly, and secondly, we think we should do more precisely for those reported suspicious cases. We do all the testing, yeah, and we think if we do the mass testing, it will cost not only lots of money but also a lot of time, and sometimes you waste your resources. That's why we haven't yet adopted the mass testing.
Yes, and you listed a lot of measures taken, including you know data use of data, surveillance of patients. But Taiwan was able to do all this in a democratic setting because
Yes.
there have been discussions that, oh, it will be difficult to control the pandemic in a democracy. But your experience shows that it was not. So what are your thoughts about democracy, being in a democracy and containing an emergency?
Okay. We all know that a Chinese doctor named Li Wenliang, when who was based in Wuhan, China, was intimidated by the Chinese authority for openly warning about the dangers of a deadly new virus now spreading around the world and killing more than 50,000 people up to date. Ironically, that vividly shows how effective an authoritarian regime could achieve for covering up the story of the outbreak of the new virus. If China did not hide the outbreak of the new virus at that time, the epidemic would be very likely contained in time, and there would not be so many innocent deaths today. On the contrary, Taiwan's successful experience in combating COVID-19, showing democracy prevails even when facing unknown challenges posed by COVID-19 pandemic. Taiwan's democratic system has efficiently and effectively enabled the government and the public to work together in fighting COVID-19 pandemic. Here, I would like to share with you Taiwan's secret formula. We call it the 3 Ts for combating COVID-19 in the following. First, transparent. Central Epidemic Command Center holds a daily briefing, sometimes even twice a day, to inform the general public the most updated information on COVID-19 in Taiwan. The briefings are live streamed on the internet. For anyone, the government of Taiwan has used all sorts of communication tools to make known the updated information to the general public from day one. Trust. People in Taiwan can easily access the most updated, correct information. They also understand what the government's policy and the measures are. With such trust, people will not be panicked and are willing to cooperate with the government. The third one is technology. Taiwan is a country with advanced ICT, R&D, and manufacturing capabilities. We are able to merge big data in our National Health Insurance and Bureau of Immigration to design the high-risk patients warning system and the real-name mass rationing system. Taiwan also used mobile phone tracking, digital fence tracking, and health reporting systems. In a word, a democracy can effectively battle the virus as long as the government is taking the right decision in time and its people are following all the measures.
We will remember that, Ambassador, the three T's: transparency, trust, and technology.
Yes,
Yeah, I think trust. Would you say that all are equally important, or what is the most important among these three T's?
I think that they are equally important. Every element. Yes.
Yes, because you were saying that you would use the mobile phone to track down patients or those in quarantine. So there was no resistance from these citizens because
I
they
think our
trusted government. They trust government.
Yes, I think before we adopt these measures, we already informed the public through public advertisement in TV channels. We try to educate our people. Actually, these measures not try to monitor, to control people's movement, but just to protect those people who are in isolation, who needed to be quarantined. So that's why, with the trust from the general public, this measure has been implemented very well.
Ambassador, on the issue of diplomacy, we've also read a number of reports that Taiwan is raising its profile during this pandemic. You know, you have donated masks to US, to Europe, and of course to the Philippines and to other countries in Southeast Asia. And I was surprised to read or to learn from you earlier that Taiwan produces 17 million surgical masks a day. How did this happen, Ambassador? Can you tell us about how come you're able to do this? And is this what we are now seeing as your mask diplomacy?
Okay, I would like to say, we all know disease knows no borders. New forms of infectious disease are highly contagious and fast spreading, and no country can fight against them alone. Taiwan cannot enjoy disease-free life until the whole world is also free from the threat of COVID-19. International collaboration is important. Taiwan is working with the US and the European countries to carry out joint research on development of COVID-19, diagnostics and antivirals, and vaccines. In terms of the donation of face masks, in the very beginning, we focused on domestic response to COVID-19 because we needed to take care of our nationals first before helping others. When we have capability, we also hope that we can share resources and expertise with our friends in the world. I am saddened to learn that among over 7,700 confirmed cases in the Philippines, more than 1,200 of them are medical frontline workers. In last January, we produced only 1.8 million pieces of medical masks per day. Now we produce 17 million pieces of medical masks per day. That is why my government donated 300,000 medical face masks to the Philippine government on April 15, 2020. I would like to also share with you actually, how come we can increase so quickly our production of the medical face mask. Actually, we organized, we call it a national team. Within 1 month, this national team, they increased the production line to more than 20. So that's why we could produce so many medical face masks. It's a collaboration between the government and the private sectors. Like I mentioned, trust. Trust in the government is very important. Then we would like to help the other people. Once we have enough production of the masks, we would like to donate more to other countries which are in need of the face masks. And yeah, I understand. One more thing I would like to share with you. I understand that there's a company is called the New Kimpo Group based in Taiwan. Yeah, the CEO Simon Shen mentioned a few weeks ago. He already informed your Department of Trade and Industry, that its subsidiary company is called the Telcom Philippines, is going to produce medical-grade face masks and ventilators to help the Philippines to address the challenges in combating COVID-19 pandemic. Our President Peiyung said in an article published by Time magazine 2 weeks ago, the human capacity to overcome challenges together is limitless. What New Kimpo Group does is just one of the examples that Taiwan can help and is helping our closest neighbor, the Philippines. Apart from that, our local Taiwanese community leaders from Taiwan Association Incorporation, the Philippines, that is the Taiwan Chamber of Commerce, and the Taiwan Compatriot Association in the Philippines, they also have donated and will continue to donate medical masks and the PPEs to the Philippine government agencies and the hospitals. I want to point out that a strong defense against COVID-19 pandemic can only be built through close mutual assistance for mutual benefits.
Yes, you've been here in the Philippines for a total of 7 years, right, sir?
Yes.
Yeah, and
Yes.
then during different times, during different
Yes.
tours of duty. So, knowing the Philippines well, what do you think are lessons that the Philippines can learn from your country's experience with the coronavirus?
First of all, I would like to say, I love your country. It's a very beautiful country with very friendly people. That's why I keep coming back. It's my third assignment in Manila. So even I told my boss, the foreign minister, if I have a choice, I would like to go back to the Philippines 2 years ago. And in my observation, the Philippine government has done remarkable work in combating COVID-19. For example, the Department of Health holds daily briefings to keep the public aware of the updated information on the COVID-19 and the measures adopted by the Philippine government. My humble suggestions are that all priorities in relation to this pandemic should be listed, then examine all available resources, take swift and decisive decisions, and review the impacts of every important decision made. During these processes, we were very much willing to share Taiwan's experiences with you or do whatever we can do to help alleviate the impacts of the pandemic. There are a few things that Taiwan can share with our friends in the Philippines to fight against the COVID-19 pandemic as follows. First, proactive deployment in advance, increase mass production, public messaging, obtain people's trust to combat the pandemic together, mobile phone tracing technology, national health insurance, financial relief and economic stability are equally important while containing the spread of the virus. For example, Taiwan government provides 1,000 NT dollars, which equals 1,600 pesos per day for home quarantine people. Barangay captains can help to monitor and care for quarantined people. I sincerely hope that our lives can return to normal as soon as possible.
Wow, that's quite impressive, the amount of money you pay to those in quarantine.
Yes, I would like to go back to Taiwan and enjoy the allowance.
One more question, Ambassador, because apparently Taiwan is, slowly returning to normal, the new normal. So, how is life now? Let's say in Taipei, are your restaurants open? Can people go to to eat out? Are there movie houses open? How about the night markets? No one's going to the night markets anymore, or maybe the bookstores?
It's a very good question. People in Taiwan are still enjoying relatively normal lives. People go to work, students go to school, and people take public transportation, go shopping, go to the movies, go to restaurants, night markets, barber shops, and so on. But the government keeps on reminding the general public to wear face masks. keep social distancing, wash hands, and avoid mass gathering. Starting from March 19, 2020, Taiwan barred foreign nationals from entering Taiwan unless with special permission. All inbound travelers must observe a 14-day home quarantine upon arrival. Transit of passengers through Taiwan has been suspended since March 24 until now. On March 5, 2020, the Central Epidemic Command Center issued a guideline for the private sector to cope with COVID-19 pandemic. Enterprises are encouraged to comply with government disease prevention measures in accordance with the guideline. Currently, most of the private enterprises in Taiwan have their own stay-at-home protocols.
So stay-at-home protocols still are in place, but it depends on the each enterprise or each office.
Yes, it is true. Yeah, depends on each enterprise and each office, but we have a guideline for their reference.
Okay. Last question before we end this interview, sir, is that with all the data you have given us this morning, today rather, with all the information you have shared, has Taiwan shared this experience with WHO, with World Health Organization? Have you given them this entire report so that it can be shared with the rest of the world?
Thank you very much for asking me this very important and timely question. First of all, I want to say that the World Health Organization has been taking a very rigid position on Taiwan and very unfriendly to Taiwan. WHO often ignores communications from Taiwan. Due to political barriers, Taiwan is not invited to attend the World Health Assembly and has extremely limited participation in the activities, meetings, and mechanism of the World Health Organization. Taiwan's 23 million people are still left in the cold, purposefully neglected by the World Health Organization. The truth is that Taiwan is not able to contribute the best practices because WHO still puts political consideration before health cooperation. Taiwan is willing and looking to continue working with bilateral and multilateral partners, including WHO, to defend the global health and contain continued spread of COVID-19 pandemic. We once again call on the WHO Secretary to set aside political considerations, abide by the WHO's charter's call to ensure the highest attainable standard of human health, and bring Taiwan to fully participate in its meetings, activities, and mechanisms. Health for all, Taiwan can help, and Taiwan is willing to help.
On that note, Ambassador, thank you. But I just like to, I don't know if I mentioned this earlier, but you've got very good reviews on your performance coming from Bill Gates. He
Yes.
mentioned Taiwan as an example, as a model. So, on that note, thank you for sharing the knowledge and the experience of Taiwan. And we will keep this conversation going. We will keep watching other countries as well and how they deal with this pandemic. And we will be in touch. And thank you very much. And to our viewers, thank you for listening and watching. And we will keep you posted on developments in Taiwan and other countries. Thank you, sir. Goodbye.
Thank you, Meritus. Thank you for inviting me to your program. Let's keep in touch.